What is going on, you guys? It's your boy, Dr. Tochi here. I'm here with another update video for my channel. If you guys are new here, I am a hospice and palliative care fellow here in California. And I wanted to make these videos kind of like benchmark points for myself, and then also give you guys kind of like a inside perspective of someone that's going through palliative care fellowship. And I'm officially 1 month in, 4 weeks down. I'm going to call it 3 because I had a 1 week break last week where I actually had my birthday vacation where I went to Cancun, which was a lot of fun. And maybe I'll talk about it in another video. But I wanted to give this video for you guys to give you guys my thoughts after 1 month. And if you guys aren't aware about hospice and palliative care fellowship, it's only a year. So although only 1 month has passed, that is a good chunk of the entire fellowship, unlike other specialties where it's 2 years, where it's 3 years, sometimes 4. So I really have to take the time to not only make these videos to reflect for myself, but also give you guys the benchmarks of what I'm seeing during the fellowship and also some things that I can actually improve on for the future. So one of the big things I wanted to talk about in this video is to kind of give you guys some of the insight that I feel that I can actually improve on, some of the things that I did well on, to touch on the things that I feel like I did well on. I feel like I had a really good, strong palliative care base from my residency. I want to shout out, my people back at my previous residency for giving me such a strong foundation. They're actually the main reason why I wanted to go into palliative care. And I only really gained that appreciation for the field in my second year of residency. I didn't think about it before residency, before med school. It really just came during residency. And if I didn't have that department, who knows if I'll even be in this sort of field. And one of the big things is that with that strong foundation, I was able to, handle family meetings and, talk about more of the big picture things. And talking to my attending this week, I wanted to get a little bit of insight from her perspective on, what do you think the things that I did well on? What do you think some of the things that I can probably improve on for the next time? And the biggest thing is that she kind of shared that she felt that I had like a good, strong base in hospice and palliative care in terms of from the, the connecting with patients, having conversations, that's like a really big part. But there's a lot of other parts to palliative care, not just, from my MD perspective. And one of the biggest things that she shared that I could probably improve on next time is, instead of just taking on all the work, is also shadowing other specialists on the palliative care team. And palliative care is an interdisciplinary, group, and it's not just the MD. And it's kind of weird because it's not really a hierarchy. It's like an informal hierarchy, like the MD, like, yes, they lead the team, but you have the nurse practitioner, you have the social worker, you have the chaplain, you have a lot of people on the team, and they each have their own perspective. And if you really think about it, hospice and palliative care, a lot of people can have these conversations. It's really, what type of background are you coming from that can be used to actually connect with the patients with that level. So one of the biggest things that I want to do next time that I come on this specific rotation, or not even just on this specific rotation at the VA, but other hospice and palliative care rotations during my fellowship, is to shadow the other subspecialists. So that's one thing I'm going to do. Follow the nurse practitioner, follow the social worker, follow the chaplain, and get a sense of how they approach palliative care from their side. So when I become an attending in this field, I can actually know, this is what this, social worker, nurse practitioner, chaplain, music therapist, whatever sort of background they have, this is what they do. And instead of trying to take everything on myself, work as a team and try to divvy up, tasks and see who is probably the more appropriate person to talk to the patient based off of what their need is. So that's one of the biggest things that I want to do. I want to shadow more of those other team members, and I hope to see how much growth I get out of that. And another thing that I wanted to specifically do a little bit better on my next rotation, or not necessarily do a little bit better, but get a little bit more experience in, is symptom management. Here at the VA, it's a lot of older patients. They range from like 70s to 90-year-olds. So we had a lot of goals of care discussions talking about code status. Do you want to be on life support, chest compressions, intubations, feeding tubes? Do you have advanced directives, a living will, like a medical decision maker? Those are a lot of the things that came up during my time here at the VA, and talking to my attending, that kind of ebbs and flows. And, it is the beginning of the actual fellow cycle, and this kind of coincides with the residency as well. And one of the things that my attending was saying is that with new residents coming in, they are more so trying to hit the ground running, try to understand the system, trying to understand their teams and get a little bit more comfortable. And usually a little bit deeper into the year, you'll see a lot more palliative care consults. And then people also just tend to get a little bit more sicker in the winter months and sometimes in the spring months. So you get a lot of palliative care consults during that time. So on my last week of this rotation, didn't get too many new consults, to be honest. So I had my clinic on Monday, which was a shortened clinic. And then throughout the week, maybe 1 or 2 consults came in. So it was a pretty light week. So I'm going to be going to a inpatient hospital acute care setting at a trauma hospital next for my hospital palliative care rotation. So it's going to be a lot more busy, and I'm mentally preparing myself for that. So I have, and one of the biggest things that I'm really happy about is that I'm going from CPRS, the EMR system, back to my one true love, Epic. So I spent some time yesterday. I was on my night shift as a nocturnist attending. I spent some time in Epic kind of building my own template that I'm going to be using throughout the rotation, both for inpatient and for outpatient. And I also spent some time just kind of making one for what I presume my job will be in the future. And, I don't know, I have a really strong predilection for creating notes and templates and dot phrases. I kind of like that high functionality of the Epic EMR. So that was something I just kind of had fun, just kind of playing around with, getting into Smart List. That was a huge thing for me. But regardless, I'm going to be starting that rotation tomorrow. I'm probably going to go a little bit earlier because I have to get acquainted with the parking scene, given that it's a much bigger hospital, a lot more staff. The parking is going to fill up a lot more quicker. And also there's going to be a lot more teams there. So the parking spaces are going to fill up pretty quickly. So I talked to one of my previous fellows that we are switching with. We all are at different sites and we don't really interface with each other that much. So we recently saw each other on this last Wednesday just because we had didactics, but I got a lot of the heads up, the tips and tricks of what I should be expecting at the next hospital. So I'm probably going to leave here around 7:30, 7:45, get there a little bit earlier so I can try to find good parking. And then I'm going to meet my attendings around 8:15 and get acquainted with the system, see where everybody works, and kind of get familiar with the hospital, because when we were touring, it was a pretty big, overwhelming campus. There's 3 different wings, 3 different buildings. I was my residency was just one building. So it was very easy to get around. So this will be a little bit of an adjustment. But regardless, I'm pretty excited for my next rotation. It's 1 month down. I think the biggest thing that I have really appreciated is the type of support that I'm getting from my attendings. And for this residency, or this fellowship specifically, I have kind of learned, and the attending was kind of, pretty transparent about that as well, is that fellowship is what you make it. And especially for our fellowship, it's what you make it. So being that I'm someone that's a little bit more self-driven, seeking out for, a little bit more guidance and a little bit more, just kind of ownership and viewing in that actual field. This is actually the perfect type of fellowship for me. So I can kind of, self-direct my learning and, kind of find and mold what I'm trying to do for myself when I become a palliative care physician myself. So I'm going to wrap the video up there. I think the last thing for myself, I have a nocturnist job. It's back where I did my residency at, in that area. And kind of reflecting on it, the job is actually pretty nice. And one of the biggest things for myself is that although I'm going into hospice and palliative care, I do want to maintain my internal medicine training, which was 3 years as opposed to my palliative care is 1. And I don't know, I just have a really strong liking for internal medicine. So I don't want to just go straight into palliative care and just give up my entire, hospitalist, nocturnist job. So that's one thing I'm probably going to try to incorporate. Right now, I'm kind of leaning probably more outpatient palliative care, and then getting my inpatient fix with the admitting shifts and with the cross-covering shifts with the nocturnist job. So that's just what I'm at right now, but it's only been a month. I signed up for maybe 2 shifts of moonlighting a month from now until December. And after that, I'm probably going to keep up that pace to try to build up my skills and make sure I don't get rusty with my internal medicine background. So thank you for joining the video. I'll see you guys later. If you have any questions about hospice and palliative care fellowship, put them in the question box down below or in the comment section down below. I believe interview season is going to be starting up, so it's going to be real nice being on the opposite side of the interview season and talking to new potential applicants for this program, specifically in palliative care. So I will see you guys later. Peace. Have a nice day.